Let's talk about sex, baby. Let's talk about you and me. Okay, and it's time to kiss and tell. And the reason I say that is because a lot of times I see hundreds of women throughout the day, and we tend to talk about the same things, but not amongst ourselves. And if we were able to get together and talk about some of the more problems that we have, then we may be able to solve them.
So, it's a subject we seem to have no problem talking about with each other as women, but we sometimes know something might be wrong or doesn't feel quite right, yet we never talk to our doctor. Why is that, ladies?
On a personal note, it is difficult to talk about sex. Everyone has different ideological and social and religious beliefs regarding sex. But the most important thing is to realize that it's okay to have a healthy sexual life. And if you don't, it's something that you should talk with your gynecologist about and feel comfortable doing so.
So just in case you are not ready, we're going to give you a starting point to let you know if you are thinking, that's not right. Well, you're not alone. Pay attention, as if you weren't already.
Most of the women that I encounter have difficulty with libido. And unfortunately, there's no magic drug out there. And things that may work for one woman may not work for another. So certainly having a conversation about, what things have shown some benefit and what things are really, truly not beneficial and may harm you can be of importance with a conversation with your physician.
But what if it is painful?
You may encounter a time when intercourse is painful. Then that should not be the case. So if that's happening, you should talk with your gynecologist because it could be something as minor as an infection that can be cleared up, or it can be as major as a tumor or something going on inside. And so the workup or evaluation of a patient that's having pain with intercourse varies based on that patient's age and their cycle in life. So, and you shouldn't be ashamed of that.
And just in case you're in this boat but still don't want to address it,
there's nothing that you can make your gynecologist blush about. So certainly let them know.
Okay, ever hear the cliche, use it or lose it? Well, it might have more meaning than you think.
And the reason is your body tends to shift blood flow to where it's needed. And as your body changes, our reproductive organs also change from when we are in a pre-pubertal state all the way through menopause. So during that time, the more stimulation you give to an area, the more blood flow you get to the area. So if you don't stimulate it, it's going to not get blood flow. And now everybody is built differently, and so some women will still, may not complain about it at all. But there is certainly value to use it or lose it.
And if you've hit a point where this is a problem, do not worry. You can literally recover.
So what I do with couples and with their partners is try to, if we're going to use lubricants, creams, reintroduce the area to stimulation. And so you can do that, and that starts to help with the process because it's a healing emotionally and physically. Let's talk.